So hi everyone, my name is Ruth Ferguson, and today I will be talking about my experience in working with the Island Health Public Health team in creating an evaluation plan for the Wellness Centre at Belmont Secondary School. I'd like to start today by acknowledging and respecting the Lekwungen peoples on whose traditional territory I am speaking from, and the Songhees, Esquimalt, and Wasanich peoples, whose historical relationships with the land continue to this day. So adolescence is a critical life stage for health and well-being due to the rapid physical, mental, and behavioral development that occurs within this age group. Research has found that health-related behavior patterns established at this time can either protect against or increase the risk of health issues into adulthood. However, evidence also suggests that youth are less likely than other groups to seek support from health services for their needs and often do not feel comfortable seeing their family physicians or involving their parents with concerns surrounding sexual health, mental and emotional issues, or substance use. School-based health centres have been identified as a way to support youth health and well-being by providing accessible and timely care for students on school grounds. And evidence suggests that there are multiple positive benefits associated with accessing school-based health centres, including reduced waits for treatment, enhanced school connectedness, lower likelihood of depressive symptoms, improved grades, and improved overall health-related outcomes and behaviours. And these positive outcomes have been found to be particularly prevalent among certain populations, such as sexual minority youth and youth with low socioeconomic status. Results also indicate that youth are more likely to return for follow-up services at school-based health centres in comparison with primary health providers, suggesting that they are more comfortable with using this type of service. So the Wellness Centre at Belmont Secondary opened in 2016. It was founded on a model developed by Island Health in partnership with School District 62 and other community agencies as a holistic method to address the health needs of youth in the West Shore region on Vancouver Island. It provides confidential and free of cost physical, mental, and sexual health services to youth under 25 years, regardless of whether they currently attend school. Services are provided by a team of healthcare professionals, including public health nurses, nurse practitioners, doctors, mental health and substance use counsellors, medical office assistants, students, and volunteers. Currently, the centre operates 4 days a week on Mondays, Tuesdays, Thursdays, and Fridays. So an evaluation of this centre was conducted between September 2016 and June 2018 by an independent consulting group, Laguerre and Associates, with collaboration from multiple local stakeholders, including the First Nations Health Authority, Island Health, Ministry of Children and Family Development, and McCreary Society. Staff and students were surveyed to explore themes of access to care, educational achievement, building capacity in the health and education systems, sustainability, and social return on investment in relation to the Wellness Centre. Findings from this evaluation showed that youth and staff members were generally satisfied with services, and they also reported that these services, they felt that it supported resiliency and capacity building in the youth and increased their chances of higher academic achievement. The findings also found that the findings demonstrate that youth are more likely to seek support from friends, family, and the internet for sexual health or substance health youth concerns, and are also typically reluctant to access professional support for mental health concerns. So this demonstrates how enhancing our understanding of the perspectives and behaviours of this population group on a regular basis, it's an important step in ensuring that services are accessible and appropriate. My evaluation plan aims to build on the information from this prior evaluation by providing valuable longitudinal comparison data and identifying potential changes in youth health needs as a result of evolving contextual factors. So looking at current context, for the Wellness Centre at Belmont High School, the COVID-19 pandemic, as well as the increasing shortage of family doctors in relation to population growth, have been identified as factors that may have impacted the experiences of youth and operations at the centre since the initial evaluation in 2018 took place. The COVID-19 pandemic has caused many disruptions to regular routines for adolescents through school closures, increased isolation, and quarantine orders. And these conditions, in addition to other factors that occur at this life stage, such as brain development and the stresses of transitioning into adulthood, could mean that youth at this time are particularly vulnerable to adverse mental health outcomes. And current research supports this and indicates that youth globally are experiencing elevated mental health issues in comparison to pre-pandemic times. A recent meta-analysis of 29 global studies with over 80,000 participants found that depressive and anxiety symptoms had doubled within children and adolescents in the first year of the pandemic. A second contextual factor to consider is the current shortage of available doctors in BC and on Vancouver Island, an issue that is projected to worsen as population growth increases rapidly. Consequently, many youth do not have regular access to care, which could result in reduced quality of care and a greater risk of untreated health issues in this population. The current evaluation plan aims to capture the perspectives of youth and staff on services provided by the Wellness Centre at Belmont during these unprecedented times. So moving on to my evaluation plan, we have developed two survey instruments for this evaluation, with one designed to be distributed to students and one for staff members within Belmont High School and at the Wellness Centre. The survey for students will be distributed by teachers during classroom hours. And these survey tools were adapted from the previous 2018 evaluation framework in order to provide comparison data, with some questions added with current contextual factors in mind. So in this slide, you can see the areas of focus for the evaluation plan. We have the student health status and COVID-19 impacts that we'll be looking at. Second, access to care at the Wellness Centre and looking at accessibility. Then we've got building capacity in the health and education system and looking at how it supports youth health, wellness, and resiliency. Educational achievement and how it is supported by services at the Wellness Centre. Operational considerations, so we'll be looking at the important components and service provider team composition for the Wellness Centre and how this impacts the services that youth are receiving. And then satisfaction with services. And lastly, gaps filled in the health system by the Wellness Centre in relation to the shortage of available family doctors and walk-in clinics at this time. Our evaluation plan, including the survey instruments and the method of distributing the surveys and the themes that we've decided to focus on, have been developed with feedback from students at Belmont Secondary in order to ensure that the plan is effective and appropriate for this population. So looking at implications for practice, the findings from this evaluation have the potential to help shape health services for youth that are appropriate and reflect their unique needs and experiences. It's important that we understand the outcomes from these centres, as well as areas for potential improvements, in order to ensure that youth feel supported and are set up for success both in and outside of their high school experience. This evaluation could help to shape health services for youth in general, but also could help to demonstrate the effectiveness of offering school-based health centres as a way to reduce barriers to care in this population. This is particularly important in the context of the COVID-19 pandemic, which will likely have ongoing impacts on youth health and well-being, even as we take steps to return back to normalcy. It's also important to understand how services at centres such as this can fill potential gaps in the health system as a result of the current shortage of family doctors. This evaluation plan represents an important shift towards involving populations in the evaluations of programs designed for them. Throughout this process, I've made efforts to ensure that the youth could give feedback on this plan and that their perspectives would be present. Encouraging youth to become involved in the evaluations and development of local programs is a valuable way to enhance their leadership and communication skills and show them that their opinion can make a difference. Involving populations in the evaluations for programs designed for them is an important practice in public health and one that should be standard. So I'd just like to take a moment to thank everyone for all of their help and support throughout this process, both on the public health team at Island Health, at the school, and everyone who's contributed to my learning in this process.